First of all, I congratulate the entire West Bengal Poultry Federation team for starting this new concept of the Novacon. Yeah, and wish them all the best for the future so that we will be having a great technical sessions in the future also. With this, I would like to drag your attention to the Newcastle disease virus in poultry, which I think everyone in the poultry industry are aware of this, and this is one of the century-old disease once again. Okay, so today we talk about diseases with a lot of challenges. With the COVID emerging out, now the awareness about the viruses have increased. Everybody do accept that. Okay, now it is very easy for me to convince you about how the viruses cause the pathogenicity and how the control measures are going to be. Okay, so this is with this particular things I will go forward in dealing with this particular disease and giving some concepts, okay, about this particular virus. So these are some of the topics I am going to deal with, the reasons why it is endemic for almost 100 years, okay, why it is endemic and why it is spreading, okay, and what are the new pandemics of ND which is emerging out. We will talk about those things. And vaccine development for the last 90 years. We have got very good vaccines. Though we have got very good vaccines, we are not able to control and limit the infection, okay, and the productivity. So we will talk about those things, how we have to have the approach with the vaccines, and what is the goals with the ND vaccinations, and vaccines and vaccination failure, which is important, and how to prevent the ND outbreaks in the future. So these are all some of the topics which I will going to talk about. And what are the reasons for the endemicity of this particular virus? Okay, if you talk about this virus, we will come to see that this is a RNA virus. With the emergence of COVID, in the human COVID, everybody will understand how the mutations do happen with the RNA viruses. RNA viruses are more sensitive viruses. They can change a lot very fast. Okay, that is the character of this virus. If you take the top 10 diseases of poultry today, out of that, the top 5 diseases are RNA viruses. Okay, which includes the infectious bronchitis virus or the influenza viruses to be the top. Infectious bronchitis virus is more related to the coronaviruses, which we have learnt a lot with the COVID emergence, but nothing related with the human coronaviruses and the poultry coronavirus. Please keep it as a separate, because the industry is very sensitive. People, if we talk about coronaviruses, everything they correlate with the poultry industry. Okay, so this is the first thing we need to understand why this particular virus is endemic. It's an RNA virus, it keeps on changing. Okay, so these are all some of the characters. I will not deal with this. Everything can be got in the Google about the characters of this virus. Only I would like to stress here is a lot of genotypes are getting emerged out with this particular virus, which we need to understand. And though a lot of genotypes have emerged, it is a single serotype. That means we can have a good control measure, provided if we take it seriously and should have a proper approach. Okay. So coming to what is the features, epidemiological features which causes the ND to be endemic to several countries. What are the reasons? The first reason is, though we have got a very good vaccines for control of this particular virus, there is lack of proper vaccination procedures. The herd immunity is not getting corrected with this particular thing, which we need to address in a proper way. The second thing, though there are several outbreaks happening, it is very underreported, and we are not able to control it if we are really reporting it. Okay, and the third thing is the high density of poultry. Everybody do understand about this particular concept. It is one of the Google map of one of the area in Hyderabad area, Shadnagar. You can see how many farms are there in the distance of about 10 kilometers radius. So if there is an outbreak here, you can end up with a lot of disaster in that particular area. This is what is happening, and this is going to be a challenge in the future also. Okay? The next thing is complex biosecurity protocols. We talk about a lot of things about biosecurity, but what we are following at the farm level, it is a big challenge. Okay? I will throw some light on those things about some of the biosecurity lacunas, okay, where we need to correct. And lack of surveillance programs. Last but not the least, untreated poultry manure. Since morning, we are talking about this manure problems, the challenges with this. We are just using the poultry litter in spreading into the agriculture, which will be a challenge if it is a contaminated one. Okay? So, with that particular concept, we will talk about the epidemiology of transmission. How the transmission happened with this Newcastle disease. So, I would like to highlight here is, when a bird is infected, it can be spread through several means, except it is not a vertically transmitted disease. Okay? A lot of people tell it may be a vertically transmitted, but it is not virus is not vertically transmitted. When a flock is affected, the quality of the chicks which are coming out will be affected. That is the only thing. But how this particular virus enters a farm? Through vehicles or equipments, vaccinator crews, or the rodents, or the wild birds. You can see almost 250 species of birds can get affected with the Newcastle virus. Okay? So, contaminated feed water, feces and manure. I will draw your attention here. You can see here, the virus can stay at room temperature in the poultry litter for almost 94 days. This is a big challenge. At 37 degrees centigrade for almost 56 days. So, this is which is more concerned. And the next thing is the live poultry. If the flock is affected in the poultry cages, if it is not cleaned properly, the dirty letterware there, which is contaminated, can stay for almost 6 to 14 days. Okay? So, last but not the least, waste disposal. I have seen in several places they will be disposing on the roadside or on the nalas also. So, where I have taken some of the pics, you can see these are the source of infection to other farms. Okay? So, we need to take care of these things in a proper way to have a proper control. Okay? Coming to the virus pathogenicity, I will not ask everybody to learn about these things, but you can see here, only thing, it can spread through the naso-oral route, and it can attach to the cells, and it can infect the upper respiratory and the gastrointestinal tract in the first stage. This is what happens with the live vaccines, lentogenic viruses. This is what happens. The live viruses, vaccines cannot enter the system. Okay? So, but if it is a virulent virus, it can spread to all organs, and it can, within 22 to 24 hours, it can affect all the organs. This is what is very important. Okay? So, it can lead to the catastrophe of the disease. Within 10 days, you can, if it is a very virulent virus, the entire flock can have a mortality, provided there is no vaccination done for this. Okay? That is why we call it as a catastrophe disease. This is Newcastle, as well as a high pathogenic avian influenza can happen with this particular cases. So, if you talk about the classification of these viruses, okay, this table I would like to simplify you, though it is complicated. You can see we classify based on intravenous pathogenicity, intracerebral pathogenicity, and the mean death time. Okay? This is the lowest virulent virus, the V4 strain, which is a vaccine strain, and this is the highest virulent, which is prevalent in India. That is genotype 13 and genotype 7I. I will come to this. You can see the ICPI, it is increasing here. It is almost 0 till the mesogenic strains. So ICPI, here you can see up to 2, you can mean death time here. As the virulence increases, the immunogenicity increases. This is more immunogenic. That is, if you produce a vaccine with this particular viruses, it is very good. If it is produced in this, you can have a very less protection comparatively. Okay, this is what you mean to understand here. Now the question is whether we can produce a vaccine from this. You can see here, the mean death time of embryos is very less. In the sense, if you inoculate the embryos, it will die within 48 hours. You will not get good virus. If you don't get good virus, you will not have a good vaccine. If you don't have a good vaccine titer, definitely protection will be less. This is what we need to understand with this particular concept. The next thing is pathotypes and tissue tropism. Why this I have put this particular slide is, several people say when there is nervous signs only, people say it is Newcastle disease. Don't come to that conclusion. Always, now what is happening in the field is that whenever there is some nervous signs, they will conclude as Newcastle disease. It is nothing like that. It starts from the respiratory signs, then the intestinal signs, then the neurotropic. You can see even the neurotropic strains can have respiratory, reproductive as well as nervous forms. So only nervous forms without respiratory and intestine, you have to reanalyze your cases. You have to look into other causes of that. That is what I need to draw your attention here. Okay? So these are all the clinical pictures and what we need to have differential diagnosis. Okay? Several diseases has to be concluded from this. You can see it starts with the respiratory conjunctivitis, tracheitis, the lung congestions, and you can high pathogenic viruses can have petechial hemorrhages on the rib cages. This can happen in high pathogenic avian influenza also, and this can happen in fowl cholera also. Fowl cholera caused by Pasteurella multocida. Okay? So we need to come to a conclusion with this particular thing, what exactly is the cause of the disease. Don't come to a conclusion, this is high pathogenic avian influenza. So that is what happens. And sometimes in broilers especially I have seen with the lentogenic viruses, whenever there is some ND suspected, they will put Lasota. When they put Lasota during some respiratory problems, you will end up in vaccinal reactions like air sacculitis, pericarditis, all those things. I never suggest whenever there is any disease problem happening, don't put your live vaccines. Okay? This is what happens whenever you are putting the tracheitis and the respiratory problems. And coming to the digestive and intestinal clinical picture, you can see proventriculitis with everybody will appreciate this particular lesions typical of ND, but it can happen in influenza also. Okay? The cecal tonsil hemorrhages, all those things. But you can see here, this is very common nowadays. The black proventriculus, proventriculitis, the black proventriculus. This is very typically caused by E. coli infections. The strain is O142. You can Google and check what is black proventriculus. You can come up with saying that it is E. coli infections. So we need to have a proper differential diagnosis when we are dealing with the postmortem cases. And even you can see, whenever there is petechial hemorrhages, people say high pathogenic avian influenza. Don't come to such conclusions. You can also correlate with the liver. You can see petechial, this thing, necrotic foci, miliary necrotic foci. It can be seen in fowl cholera also. I'm trying to draw your attention so that you, whenever you go, don't fall into conclusions. That's why I'm showing such sort of differential diagnosis. And the intestinal hemorrhages also. When coming to the reproductive, oophorytis, egg abnormalities, everything, but this can happen in egg drop syndromes also, as well as the IB infections also. We need to have a proper differential diagnosis in these cases, And in bacterial infections, this can also be correlated with salmonella and fowl cholera also. Okay. So coming to the nervous signs, torticollis, I was talking to you about such sort of differential diagnosis. You can see in the hatchery where you can have some alopecia in this thing. It is more related to AE, and you can see in the field also the nervous signs with the AE in the early stages. We have to have a differential diagnosis for this. And sometimes the vitamin deficiencies, I have seen several commercial farmers with this particular cases, the nervous signs, they conclude it as ND. But you need to see whether you have any affections of the respiratory as well as the intestinal tract. Okay? So these deficiencies of vitamin E, vitamin A, all these things matter in these cases. Okay? We treated with these vitamins and the problem was solved in these cases. And also the vaccination error. Lot of vaccinators damaging the blood vessels as well as spinal cord. So that matters in doing such sort of nervous lesions. So even some bacterial infections, like the simple example I can say, proper debeaking, if it is not done properly, if the infection flares up, the bird is not able to take the feed, okay, that will lead to some deficiencies. That is one thing. The second thing, the infection, bacterial infection can flare up and cause sinusitis and can affect the eustachian tube. It can also lead to the nervous signs. So have a proper diagnosis when you are checking with these particular cases. And the new outbreaks which is happening currently having such sort of lesions, which is more related to, we have tried to isolate some of the new genotypes, that is genotype 7I. You can see the airsaculitis with the petechiae being seen. Most of the time we may conclude it as hypathogenic avian influenza, but this is the new genotype which is emerging. You can see this is the last couple of years they had a lot of problem in Pakistan, okay, our neighboring country. You can see in 2009 in Pakistan almost 60% of the commercial broilers initially reported as having dead from AI. They concluded it as AI, but later on they confirmed dead due to the Newcastle disease. This is what happened in Pakistan, which we need to have awareness. Let's see what exactly is this particular genotype which is emerging. Okay? If you talk about the ND pandemics which has evolved in the last 100 years, you can see the first genotypes were in 1920 to 1960. It is more related to genotype 1, 2, 4, which is more of lentogenic and mesogenic. Today we are using this as vaccine strains. Please try to understand all the vaccine strains which we have developed today, which we are using in the field, as some or the other day it has caused a outbreak. And why I am telling is this, 100% it is not safe. There will be some vaccinal reactions. You have to use it in healthy birds in a proper way. Like some people are using mesogenic strains on the fourth week, which is very dangerous, which we need to properly understand when we are practicing. Okay? The next genotype which emerged is genotype 3, 4, 9 and 10. This is in Europe, Middle East it is 6, and the latest which is causing the problem since almost 4 decades in India, since 1984, there was the first outbreak of genotype 13 in India. Till now, this is the virus which is prevalent and endemic in India, genotype 13. But of late, our neighboring countries are having huge problem with genotype 7I, that is, which is currently called 19, which is being a threat to India, and we are currently identifying this type of strains in India. Okay? So this is the global scenario where you can see different genotypes prevalent in different countries. When it comes to India, it is 13 since almost 4 decades. Okay? Since 1983, you can see 1982, you can see here. This was the published about genotype 13. But this is the Why? There is a lot of confusion in the genotype classification, but this is big. It is the errors of the scientific publications which happened. Over a period of time, there will be upgradation of the classification system. That has led to the change. You can see here, there is no major change in these genotypes, but you can see, especially in the 7, which is the old classification, which is presently 7 also, but now in the new classification, some of the strains have been removed and they have given a new name. Like 7B, it is 13 in India, and 7I, which is 19. Okay, this is of interest for this thing. So this is the challenges in other countries, how the 7 is creating a problem in China and Nigeria also. And this is the latest publication which has happened. You can about the 7I. You can see it started from Indonesia in 2010. It spread to Pakistan and Middle East, and it is spreading to European countries also. When it comes to 13, they are talking about 2003, but it was earlier classified as 7. It was from 1983. Since 1983, we have this particular problem with 13, which has spread to other countries, Middle East and other countries. So we are endemic to 13B. Now the question is whether we are getting the challenge with 7I. So this is the phylogenetic tree of 13. Okay, you need not bother about this. We are working on this. Only thing I would like to highlight here is the current challenge with genotype 7I in India, which is causing a lot of production drop and high mortalities in broilers, production drop in commercial layers in vaccinated flocks, and high mortality in broilers or the commercial layers less than 6 weeks. This is creating a problem, and in the central zone, that is Chhattisgarh, Jharkhand area, all those things, we have a lot of isolates which has been confirmed by PDRC that it is belonging to 7I, which is currently called 19, but this is 7I which is emerging out. These are all some of the isolates from the East Zone. That is, East Zone means it is not from the West Bengal or whatever it is. These isolates are from the Chhattisgarh, Jharkhand and North area. Okay, maybe it may be prevalent in West Bengal also. We need to do a survey of these cases. Okay, now coming to how to protect against the ND challenges which is happening. Okay, so vaccine development for the last 90 years, the question is whether the vaccines are a treatment. Most of our practice are concentrated on this. Though we do prophylactic vaccination, but whenever there is some challenges, we go for additional vaccinations as making it as a treatment. Most of the people tell whether you have done Lasota before. That is the first question they ask, which I always objected. This is something I coined like this, which was told by Adolf Hitler. If a lie is told loud and long enough, people will begin to believe it. This is what has happened with the treatment, vaccines as treatment in NT cases. So the whatever the concept, it has been told loudly and for a long period. So we need to now review such sort of things. How to do that? Okay. So if you talk about the vaccine development for the last 90 years, the first strain which was developed was the mesogenic strains. That is, presently, till today we are using it, R2B as a mesogenic virus as a vaccine strain. Okay? So, but most of the countries which has developed, like the Roykin, H strain, or the Komarov strain, all these are mesogenic strains. They have withdrawn this vaccine, most of the countries. Only Southeast Asian countries, we are still dependent on this vaccinations. But why it was withdrawn? This is capable of causing disease and high mortality in susceptible birds. But in our conditions, if we are using this particular strain, we have to have certain conditions in place. First of all, we have to have a proper immunity in the bird before using it. Good titers of more than 64. Whether we can achieve that, when we can achieve that, you can use that. But don't misuse this vaccine like You have some laying flock, use in that flocks. You have some growing flock, 4 weeks, you can use that. Don't misuse that such sort of concepts. Okay? So, based on that particular challenges, these live vaccines, mild strains of lentogenic virus were identified by different authors, like Hitchner developed B1, Budet developed Lasota, and Aspelin F strain they developed. So, a lot of mild strains were developed. Though these mild strains were developed, it is not devoid of the virulence. So, that's why the concept of cloned vaccine came. Identifying a milder strain from the Lasotas or this thing. So, that is to avoid minimize the post-vaccinal reactions. What is post-vaccinal reactions? In a laying bird, when there is production, if there is any other disease problems like the mycoplasmas or some bacterial infections, it can create more production drops. That is called as vaccinal reactions. So, to minimize such sort of these things, such sort of vaccines were developed by different companies. Okay? So, but even today, that has some objections on those things. So, the other concept is the vectored vaccines. Though the concept is been this thing using the Marex virus as this thing, they are using fusion protein gene and developing a vectored vaccine. But several questions are still today have to be addressed in a proper way before we adapt in our country. Like we are using only fusion protein. What about HN gene, which is also important in the protection? We are testing our birds for the protective titers with HI titers, hemagglutinin inhibition titers, but we are using fusion protein in the vector. Whether we can include both the genes and then have a very good vaccine, that is the concept we need to think about. And coming to the latency to be used, like in a long-lived bird, if you are using this particular vector vaccine, if the Marex virus usually goes into a latency, it will not be in an active replication form. How to develop antibody titers or the antigens in the bird for a long period so that you will have a good titers. That is what we need to think about. And the third thing is local mucosal immunity in the early stage, which is also need to be addressed. And long-lasting immunity, how to maintain the titers. All these things have to be addressed properly, and definitely this concept will take up if these things are addressed in a proper way. Okay, so then coming to the goals of ND vaccinations. If a flock is vaccinated properly with whatever the vaccines which are available with the live and killed concept, whenever there is an infection with genotype 13 or the 7i, definitely it will protect against the clinical signs and mortality. This is how the licensing has happened. But none of the vaccines will promise you the shedding. Whenever there is a challenge, fecal shedding can happen. When continuous fecal shedding is there, continuous infection. When continuous infection, some or the other time, it will be coming to the infections. So, to minimize this, definitely we should think of a homologous vaccine. That is, with these strains, if we are using this particular strains in the vaccine, definitely we can minimize the shedding of this particular challenge viruses. This is what we need to understand. So, if you talk about the ND titers and the immune response, we should have a herd immunity. Okay? What exactly is the herd immunity? If you are vaccinating, most of the people would have seen this particular titers, 8, 16, 32, all these things. If your vaccine antibody titers are in this range from 64 to 512, majority falling in these two range, 128 and above, your birds are protected. Okay? So, if you see the challenge, if it is very less, whenever there is a challenge, you will have high mortalities. Okay? You should have a very good titer of 64 to prevent from clinical signs and mortality. Egg production, 128 and above. Viral shedding, 256 and above. So, for egg production, you can see, if you have a titer of 128 only, you will have minimal titers. Now, the question is, what is immune response to challenge? You have good titers, how the immunity works whenever there is a challenge. These titered birds will have mortality, but these birds will not have mortality, but the immune system responds to release more antibodies. When the antibodies are released more, the titers goes to 4,000. That is how the antibody titers will attack the virus and remove the virus out. That is how it works. You can see this is the example of one of the flock. This is the standard antibody titer. Whenever there is a challenge, most of the birds are falling in the range of 4,000. This is what the immunity responds. You need not vaccinate these birds. It automatically, the body is responding to the challenge. This is what happens. Okay? So this is some of the breeder flocks where we have monitored. This is what the antibody standard we expect. At 21 weeks, you can see before the 4-lay, the titers are less. At 27 weeks, after 4-way, you can see the titers are going to the very good protective titer. But it will not stay long because it is the killed vaccine which maintains the titer. When you are giving a killed vaccine in a breeder, it will work up to 18 to 20 weeks till the vaccine is there at the depot. Once the depot is exhausted, the titers start coming down. Okay? So if you do mid-lay vaccination at 39 weeks, the titers once again goes to a good protective titer, above 128 and above. And you can see at 57 weeks, it is coming back. When it is coming back, definitely when there is a challenge here, it will have production drops. Though mortality may not be there, but you can have production drops. So try to maintain the titers in a protective way. This is in one of the example in commercial layers. You can see this is the titers value, 64, how many birds are there. At 12 weeks, you can see this is good protective titer at 12 weeks, but as there is no production, that's fine. But if you see at 18 weeks, most of the titer should falling here, except one. At 37 weeks, you are maintaining the titers. By 60 weeks, there is no mid-lay vaccine done in this particular flock. The titers are coming to 60, 64. So when the challenge happen here, huge production drop you can face. You can see here, there were some live vaccines. This is the standard BV300, this thing, the dotted line. This is the standard production. Whenever there is a live vaccine used, you can see the production dips happening. And this was the challenge happened where the exposure titers are 74 weeks. When the challenge happened, you can see there is high titers, exposure titers. You can have production drops here, though no mortality. Okay? So this is the different vaccination programs for breeders and all. Okay? This is, we can discuss about those things. Coming to the broilers, what will be the concept? Okay? You can see here, you will have a good maternal antibodies. It starts waning off by 2 to 3 weeks, it comes to the bottom. If there is no vaccine done, you can see the titers will go down. It will maintain low. That situation will not come. Okay? If you are vaccinating with a live vaccine, you can see it will touch to the bottom, then starts active immunity here. Okay? If you have a live killed vaccine in the early stage, it can take up at a very high level. Okay? So, though it comes down, you can have a good titer compared to the only live vaccines. Okay? But when the challenge happens, this is a very critical window. As I told, in broilers, in the early stage, you will not be able to achieve more than 64. It is not possible. So, definitely, the critical period is here when the challenge happens. That is where the biosecurity comes into picture. Okay? And the immunism. But this combination at the hatchery, ND killed with some immune complex vaccine of IBD, that will work good based on the challenges happen. But I will try to address here about the vaccinal reactions which we are facing most of the time. It can happen even with the lentogenic viruses when there is certain concept challenges with these factors. Okay? Like even mild lentogenic viruses can cause all these reactions. Okay? When there is mycoplasma problems, when there is immunosuppression with IBD or adenoviruses, this can happen. Or strong lentogenic viruses as primer, poor vaccination techniques, spray vaccination, all these things can cause the reactions of the vaccines. Okay? So, A small topic on vaccine or vaccine failures. According to me, it is not a vaccine failure. 80 to 90% of the time, it is the vaccination failure which is creating a problem. Okay? So try to address this particular issue in a proper way in the farm level. Like the eye drop vaccinations, sometimes some people are using some syringe needle. We don't know the proper dosing. Whether the vaccinations are happening properly, we don't know. And the flocks are very high numbers. And this particular thing, people are waning off. Okay? When it comes to drinking water vaccination, we don't withdraw the water sanitizers. If we are not withdrawing the water sanitizers, there is no meaning of vaccines. Vaccine itself will get destroyed. Such sort of things has to be addressed. This is one of the subcutaneous or intramuscular vaccination. This person you can see, he is holding 3 chicks. Whether the subcutaneous vaccination can happen properly? This is what happens in the farm level. This is when I audited some of the vaccinations. This is what the errors do happen. When they vaccinate it, you can see the reactions at the neck regions. Okay? The leakage happening or the damage to the blood vessels, all these things. Even the needle matters. You can see that person is using for 10,000 chicks and he is not changing. Okay? Not only that, it will damage a lot. And you can see here in the layer farm, how many, 20 birds she is holding. How many mistakes it can do. Such sort of things you can see here. This is damaging the spinal cord and you can see the torticollis issues. Okay? Such sort of things has to be addressed at the farm level. Okay? Not only that, the nutrition and management plays a very important role, which has been addressed by some of the speakers. You can see, though they have vaccinated with 2 killed vaccines before going into lay, then also your titers are not going above 32-64. Okay? When we visited the farm, the production drop was almost 30%. This is the condition. The toxicity or the mycotoxins or the hygienic conditions which is leading to all the bacterial aggravations. This is what happens. You cannot expect the titers to go high if your nutrition is very poor or you have a very toxic feed, etc. Okay? So take care of such sort of things. Okay? Lastly, how to prevent the ND outbreaks with all whatever which I have covered during my presentations. Okay? The host factor, the agent, and the environment plays a very important role. Like the immunogenic vaccines and the vaccination program which I discussed are very, very important. Okay? We need to understand about the source of the bird, age of the bird, nutritional status, all those things. Okay? And then the virus as such, with the emergence of the new virus which is happening, we have to have our proper cleaning and disinfection, that is biosecurity in a proper way. Okay? So that that particular virus doesn't enter our premises, but with the genotype 7i which is emerging, we need to be very cautious. Okay? Which is the next pandemic which is happening in several neighboring countries. In our country also it has happened, it is emerging out. We should be very cautious. Okay? Strengthen your biosecurity with all these factors. So this is what I would like to highlight to prevent the ND outbreaks. So thanks for that. Diseases don't have to make headlines. We can stop them before they spread widely. We can definitely stop them, but knowing what to do is very less. But knowing how to do it is what I have highlighted today. You can take some of the points and try to implement it. So this is very important, which is only we know is a tip of iceberg, and knowing how to do is very, very important. Thank you very much.